My background, I do have an MD. I pretty much have taught clinical anatomy to doctoral candidates, to PA, physician assistants, and all that. I my pretty much my real job is teaching anatomy to college students, so anatomy, physiology, and micro, and so that's actually where I'm coming from. There are some problems with Kyusho. One of the big things that we have is it's hard to test. I mean, you think about this. How would you test to see if anything that I'm talking about, if any of these pictures are correct? If you wanted to be like, look, let's see if this works. You can do it, you do it one time and then lose a student, right? And so it's hard to test it. And the problem with that, it actually can end up being mixed up with, pseudoscience and legends. Oh, someone did this move and 5 days someone died, or this happened and this person. And so you end up having people actually making up stuff like, well, if you build up your spiritual energy and attack them with that, it's going to hit the point right. And the thing is, sometimes the legends are true. Sometimes they are, but over here they tell you about the fish story. You catch a fish, it's this big, and by the time it gets back to you, it's a shark that was living in a river somehow. The other problem is the one that I actually mentioned earlier. A lot of these images are two-dimensional, and sometimes that two-dimensional image doesn't really translate to a three-dimensional structure. Now, there's a lot of different things that can work as Kyusho if we're looking at it as ending the fight. If you think about it, I've never broken anything on myself, but if you've ever seen someone break a clavicle, for instance, the collarbone, usually any fight that was in there, a lot of times is over, not because of the pain, well, the pain too, but a lot of times it's just that shoulder won't function right. Besides that, it can also cause different tears, which will be other things. So fractured bones can cause it just based on the structure. And I'm using this picture here because these words here are all layman's terms, what people would use in the street. They don't necessarily mean the same thing. And even in this picture, you'll actually notice that some of the stuff isn't really where you would say it is. For instance, if you look at the image of the wrist,
yeah,
it's actually not where the wrist is. So sometimes actually these Kyusho points are not perfect, and sometimes they're not complete. And so if we actually just look at the points and use the words that people are telling us, we may not get the right spot. I love actually one of my favorite ones is the solar plex way up here. There is a spot there, but solar plex would be more down here. So a lot of times when people are dealing with Kyusho, they're dealing with pictures that may not be actually labeled correctly, using layman's term for something else. You'll notice that there's this H pattern I drew in. There are actually places there, which is actually in the temple here, which is actually the weakest spot of the skull. It's a point called the pterion, PT, pterion, I spelled it here. And under it, you have, well, technically it's the middle meningeal artery. And with enough force, and it's actually not as much as people think about, you can break that spot. And the artery is running inside the skull here. If that breaks, it can tear the artery, and it's going to end up causing pressure within the brain. It's actually called the xiphoid process. Until you actually get to 40, it is cartilage. Cartilage is relatively easy to break. The problem is just behind this is your liver. And if your liver gets hit, especially with the sharp projection, it can tear. This would be, nowadays they can actually take you to hospital, fix stuff. But in the past, this would be pretty much a death sentence. It would be trying to find a way to sew up a leather bag leaking water. And you have the clavicle here. And the clavicle is actually the easiest bone, one of the easiest bones to break, but the most commonly fractured bone after fingers. And the problem isn't just breaking that, but this bone is holding your shoulder together. If this breaks, the humerus will actually dislocate, the scapula will actually come forward too, and so that arm could potentially become useless. You'll also see a line over here and a line here. Now, direct blunt trauma coming down in that area can actually cause a break here over that line. So if you think about getting hit right in the nose here, then this entire area is snapping off. This part of the lower portion of your face or the upper portion of your mouth can actually come down. And there's a lot of problems with that. Mainly, that area is also holding your eyes in. So you actually have instability of the eyes. If you go to the sides, you can break the zygomatic bone, this bone here, and that will also destabilize it. And that can end up leading to injury of the eye. This image here, the floating ribs. If you were to take anatomy seriously, you find out that the floating ribs are not in the front, they're in the back, and they're actually harder to break than most people realize. Two ways to think about it. If you ever break boards, imagine someone holding a board with one hand and you're trying to punch through it, the board will jiggle around. One of the big things that I tell people is if you are going to be looking at Kyusho as for points, we can't test them on people because for obvious reasons. But what we can do is we can use emergency medicine, sport injuries to see what works without just saying, well, it works because, my teacher told me that it works. We can end up going into the whole idea of here in the US for the CDC, the hospitals will actually tell you how many injuries they had and what the outcomes were. And so we can use these points to see how these Kyusho points would actually function in real life. And then we can work to recreate the injury.